With baseball season in full swing now, we can't ignore the fact that it isn't just the major leaguers out there pitching from a mound. And the truth is, even our youngest athletes are at just as much risk for injuries as those with years of experience. So it's really time for a reality check and, of course, some advice from orthopedic surgeon Dr. Komisar. He is with OrthoNeuro. So thank you so much for being here.
Thank you, Robin. It's great to be here.
You know, the topic, as I kind of alluded to, we're focusing on these young athletes. And do you see that more kids are starting sports at a younger and younger age?
Oh, clearly. I think there's more and more opportunities. It seems like parents are eager to get their kids involved and at an earlier age and keep them busy.
And so you see a lot of injuries you were mentioning that involve throwing. We talked about baseball, that kind of thing. What are the risks then in playing one sport when you're, 5 years old, say?
Well, I think early on the big advantages of sports are just participation with your peers, developing different athletic talents and skills. I think early on you just want them to play, and then as they get older, it's natural to maybe specialize more in one area, but there are some detrimental aspects of that.
Yeah, and what are those? I mean, so you're saying when people maybe choose something and just one sport, right? They're just playing baseball every year. That's not always a good thing.
Well, I think with the proliferation of travel teams, AAU ball, club teams, kids are kind of forced into one sport in many instances, and evidence suggests that there's a higher incidence of injuries in these sports, whether it's perhaps throwing injuries in baseball or shoulder injuries in volleyball or swimmers, basketball players and soccer players perhaps with knee injuries. So it depends on the sport, but that kind of focus and lack of kind of a break or rest time seems to have a negative effect on some of these adolescents.
Okay, and so what can they do, or is there anything they can do to kind of help avoid these injuries as they're going through sports?
Well, I think this time of year, to use baseball as an example, the stresses of throwing put a lot of pressure on the elbow and the shoulder, especially in the young athlete. And so pitch counts are implemented initially at the Little League level, but they've kind of risen up to the high school level and beyond to limit that, how often they throw, and then how many days of rest they get in between starts or throwing episodes. Some of it varies by age, as skeletally immature athletes have different risks with their elbows and shoulders than maybe a high school or college age athlete.
And so what if they, did not have the pitch counts, they kind of start feeling the pain, feeling these injuries. What kinds of things can they do to help kind of rehab and heal from that?
Well, besides the rest, certainly training in the off season, working on mechanics, especially as a thrower, using your lower body or core to help throw can minimize injury, but also helps improve performance in these athletes.
And so do you see a lot of kids too? I mean, is surgery still a last option, obviously, when it comes to kind of helping them out?
Generally, I mean, most of these injuries are what we term overuse injuries, so they can be treated with rest and the right rehabilitation program and often some education around that. Surgery is done in certain instances, perhaps ACL tears or recurrent shoulder dislocations, but those are less common in the younger patients.
Now, and at OrthoNeuro too, I know you offer a throwing program, right? And
Yes.
kind of what does that do for an athlete? Can it help, the inexperienced as much as the experienced athlete?
Oh, absolutely. It's really applicable to athletes of all levels and ages. Whether you're just coming off an injury that was treated with therapy or perhaps surgery, it can help kind of progress their throwing program and get them back to play at a graduated rate and not just kind of throwing them into the fire where they may be more likely to fail or have a setback.
And how long does that take? Is that a year-long program? Is that something that they need to focus on for a while before they go back in?
Well, it can be up to a year after throwing shoulder surgery or elbow surgery. It's not as lengthy and a non-surgical problem, but it can vary from weeks to months depending on the level of the activity and the age of the patient.
So it definitely pays, though, to go in and get it checked out as soon as you're feeling that pain so you can have somebody kind of guide you in the right direction.
Oh, clearly. We always say don't throw through pain or don't run through pain. Just pain's your body's stop sign, so we want to kind of take pause and evaluate that and help them maybe get back to their activity, but do it in a safe manner.
All right. It is OrthoNeuro. If you think you have any kind of situation that you want to be checked out, you can give them a call, go to the website. And of course, thank you so much for bringing that to us today.
My pleasure. Thank you, Robin.